Before we begin, we'd like to let everyone know who is following us live for the Finance Committee meeting that there were some technical difficulties, and those who want to visit that meeting, that will be available on the regular channel. So it was recorded and uploaded tonight. So you'll be able to view that meeting online. Okay. The first item on the agenda is conflict of interest. Anybody need to disclose conflict of interest? Seeing none, I'll move to the mission statement. Dr. Nettles, would you be kind enough to read our mission statement?
Yes, I will. Thank you. To improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Thank you. The next item on the agenda is public comment.
There are none.
Okay, thank you. Next is our minute. Has everyone had a chance to review the minutes? And if so, do I have a motion to approve?
So moved.
Second.
Any discussion? All in favor?
Aye.
Aye, motion passes. Seeing no old business, we'll move to new business. We will move on to there's no updates at this current point for Section 7A. We will move on to Section B, which is Press Ganey Employee and Physician Engagement Survey. So Keith Kobochak, please. Thank you.
All right. Can you hear me okay? Is the mic working? Awesome. All right. Afternoon, everyone. Thank you for the opportunity to join. My name is Keith Sobchak. I'm a workforce advisor for Press Ganey, who you all partner with here at Nashville General to conduct your employee and physician experience surveys. Purpose of my time today is to take a look at a high-level view of the results from the most recent engagement surveys we conducted this past summer for both the employee and the physician experience. We'll take a look at some of those high-level results and also kind of dive in and provide some insights to what we're seeing based off of the survey. From an agenda standpoint, you'll see here, we'll take a look at understanding engagement, the organizational impact that it does have to having a highly engaged workforce. From there, we'll dive in, take a look at summary of the key findings from the most recent engagement survey. After that, we'll take a look at what we refer to as key drivers, the items that matter most to the folks here at Nashville General based off of the survey feedback and the performance of those items. And then after that, we'll take a look at segmenting out some of the data to find those pockets of opportunity. Where can we focus some of our attention and efforts at from a leadership standpoint to continue to enhance the experience here at Nashville? And then in closing, we'll look at some focus areas and insights and tactics. First, take a look at the why behind the engagement surveys and why do we do these engagement surveys? Ultimately, it's because it's a foundation of safe, high-quality care. Measuring engagement helps us understand our employees' perceptions on how well our organization is living out its missions. Next slide. This slide shows how everything works together. Safety drives employee experience drives quality, quality drives patient experience, and ultimately patient experience drives efficiency. So the engagement survey helps us validate where we're at right now, and then we'll track and measure improvement over time. Next few slides here we're going to get into are going to look at some of that numerical data that we captured from the survey. So if you're unfamiliar with the Press Ganey surveys, just want to provide a little bit of insight. We ask a specific set of scaled questions to the employees and the physicians. They then respond to that on a 5-point scale, ranging from anywhere from strongly disagree all the way up to strongly agree. So as we look at these numbers, keep in mind they're on a 5-point scale. We then look at those scores and gauge them against a national healthcare benchmark. From those scores, we then place those scores into a percentile, so you know against the benchmark where you're at from a percentile ranking. Percentile rankings range from the first percentile up to the 99th percentile. 99th percentile would mean you're outperforming 99% of our database. Of course, first percentile, the opposite. You're outperforming only 1% of our database. So as you look at some of these numbers, keep that in mind as we move forward. Before we get into some of the numerical scores, I always like to look at some of the open-ended comments we received back from the group. We asked 2 questions of the group to where they had the opportunity to respond with free responses. I'd like to look at these and see how connected these are to the mission that we have here at Nashville General. I'll read through a couple of these just to kind of give you an example. Every day I get to be part of something bigger, supporting mission that truly puts patients first and serving a population that deserves compassionate, equitable care. I love the community-focused mission of NGH and the efforts that the organization goes through to support the community, helping to provide quality health care to our underserved patient population. So these are just a few examples that we received back from the employee survey. They had the opportunity to provide their direct feedback. This is what they're saying, and you can see how this ties directly to that mission that was just mentioned a few minutes ago. A few key takeaways to our employee engagement survey that I want to highlight at a high level. First off, engagement. Engagement levels were stable in regards to the engagement score itself year over year, and that happened during a year where we saw a national decline in our healthcare benchmark. Our benchmark declined by 0.07 in its engagement score. So to see that we remain steady in a very challenging year in healthcare is definitely a positive. We do see some opportunities as we dive in deeper to that engagement metric and see that 22% of the employees are neutral in their sentiment. That's a good news thing because that means that folks aren't necessarily unfavorable. They're just kind of on the fence, and we've got some practices that we can put in place to move them to a more favorable sentiment. Leader Index, which measures the connection that leaders have with their direct reports. This has historically always been a very strong point here at Nashville General. It's a strength with 73% of the departments that we surveyed showing and reporting that they have a high leader index. Communication and feedback are high and showing increases versus 2024. Response rates to the survey came in at 80%. That's well above what we typically see nationally. Nationally, we normally see that around 68 to 70%. So seeing that 80% response rate to the most recent engagement survey was a great thing to see. That typically reflects strong level of engagement, willingness to share feedback. When folks respond that highly to a survey, that means that they're bought into the process and know that their feedback is going to be used for improvement down the line. Safety culture, we do have an opportunity to improve some of the perception of safety as some of those scores specific in those themes were in the lower quartile in regards to that healthcare ranking. We definitely saw some growth, but still areas of opportunities to improve based off of some of that data. All right, so let's dive into the actual survey results itself. Next slide. This is our engagement survey with the engagement score itself. So on that 5-point scale, we come in at a 3.95 in overall engagement. Again, that remained flat year over year. That is a win considering the challenges that we've seen across the board in healthcare. Within that 3.95 and that engagement scoring, you can also highlight the percent of the population that fell into various levels of engagement. At the end of the day, we had about 70% of our team respond that they're engaged. Of course, we have opportunities with neutral and disengaged, but seeing 70% is such a strong showing. Beneath that score, we'll see some percentile rankings. We talked about that. The higher the number, the better. That's ultimately our goal. Against the national healthcare average, which is our most robust benchmark, it captures about 1.4 million respondents in healthcare. We're in the 44th percentile, very close to being on par with the national averages, and we can dissect the survey information to see where we can improve. A few strengths and opportunities that we've got bullet pointed over there on the right. Employees report a strong sense of purpose, with 96% saying their work is meaningful, makes a difference. Benefit satisfaction is very strong, scoring in the 79th percentile in our national healthcare benchmark, contributing to the overall employee well-being. A quick note on that benefit question. I work with a lot of clients in healthcare. They have taken the path to remove questions about pay and benefit. It's just not beneficial from a scoring standpoint because typically they're scored low. Nashville General still asks about benefits, and it's showing that that is a top-of-mind thing with the employee scoring in the 79th percentile in regards to how they feel in their benefits package. Resiliency is a growing strength, with overall resilience scoring in the 61st percentile, resilience decompression, associates' ability to disconnect from work, scoring in the 57th percentile. They're showing progress in emotional recovery and stress management. Now, we do these surveys not to only highlight successes, but find some areas of opportunities to continue to improve. One of which that's kind of came out is communication between departments. It's had some gains since last year. However, it's still an area of focus. In regards to communication from senior leadership, that's one of the items we actually saw the biggest year-over-year increase. To put a number on it, it increased by 0.34 year-over-year in regards to perception on senior leadership communication, but still have some opportunities for communication between departments. We're able to then segment out this data to specific demographic groups and help leaders find those direct areas of focus and have more targeted efforts with improvement planning. These are just a few examples of that we look at in regards to generational data and also retention itself, and the likelihood of staying with the organization is an area of focus. That trend is particularly pronounced for employees within the first 6 months to a year worth of service here. So it allows leaders to have more of that targeted insights and discussions when it comes to their improvement planning strategies. This goes over those individual questions that we asked the participants to score on that 5-point scale to give us that overall engagement score. You'll see the items here, the text in the left, and then those arrows pointing up or down in that overall score and trend section. You will see 3 of the items showed a pretty nice increase year over year compared to 2024. We do have 2 items that showed a bit of a decrease versus 2024, but nothing statistically significant. One of our biggest gainers is the item, I feel like I belong at Nashville General. Sense of belonging is such a huge driver in healthcare engagement overall. So it's very nice to see our performance there jump up pretty nicely, 0.06 versus 2024.
May I ask on that slide, the AHA4 reference, what is that?
Yeah,
group
great
of?
question. Thank you for calling that out. So we look at your results against 2 different benchmarks. The first one, our prominent one, is the national healthcare average. That's our most robust benchmark. The AHA4 benchmark is a regional benchmark. It focuses on Tennessee and some of the surrounding states. So we try to be able to provide a better peer-to-peer comparison, looking at the national levels. All healthcare workers across the U.S. is our national healthcare average, and then secluding that down to just more of a 5-state regional benchmark would be the AHA4 benchmark.
And may I ask a follow-up on each of those benchmarks? You say it's healthcare. Is that
Yes.
Is that any healthcare, hospitals, clinics? Like how broad is the healthcare pool that's included in that?
Yes, great question. So that is encompassing all employees within healthcare, regardless of the setting that they may be in. We do have other benchmarks to get a little bit more granular, but we choose to use this one as a good point of reference on how we're gauging against it. So it is all healthcare workers, regardless of the setting that they may be in. Thank you. Our next slide here highlights what we refer to as key drivers of engagement. What we do with key drivers with these surveys is we take a look and analyze all the questions that we asked. And then from those questions, based off of how folks responded to them, we're able to highlight what we refer to as key drivers of engagement. This allows leadership to focus in on the items that matter most to the folks here at Nashville General. You can see here as you look at what we've deemed to be key drivers of engagement are very strongly focused on safety. What that tells us is that you have a workforce that is dedicated to patient safety. So it's top of mind, it's one of the items that matter most to them, and they want to see continued efforts and improvements as it relates to safety, which is a good thing to see. You can jump to the next slide. This is going to highlight our highest ranked items as they compare against that national benchmark. You'll see here the text of the questions and that comparison information. I do want to highlight quite a few of these. The work I do makes a real difference. To see 96% favorable to that question is such a huge win, with an increase that's considered statistically significant versus 2024, a bump up of 0.10, a whole tenth of a point there on that question. Also, the benefits question, we highlighted that at the start of the presentation. I am satisfied with my benefits, 74% favorable, a very small decrease year over year of only 0.02, but you can see how you compare to the national levels there for benefits. 79th percentile against that national healthcare average, 98th percentile against that regional average. So in regards to benefits, that's definitely a strength here that employees are responding favorably to, and it's a great thing to talk about and mention in recruiting efforts and retention efforts within the staff. And jump to the next one here. Of course, we also want to take a look at our areas of opportunity. So this highlights focusing on some of our lower ranked items as they compare to that national benchmark. You'll see a common theme here. We've kind of touched on it already, and that's communication between departments. We've done very well this year in the perception on communication from senior leadership, but between departments is still an area of focus for us. I've met with a lot of the leaders over the past couple days. They are comfortable with talking about that. They're familiar with it being an opportunity to get better at, and they're committed to driving it home with their team as they move forward. This is what we refer to as leader index. So with all this information that we gathered, ultimately we want to be sure that we have frontline leaders in place that can talk about the results with their team and drive improvement with their team. As we look at the leaders that we have in place here, we ask the respondents to provide feedback based off of 4 specific questions that have to do with respect, teamwork, and communication. Based off of those responses, we developed this overall leader index score. The leader index score for Nashville General comes in as what we refer to as high. We categorize these leader index scores into one of 3 categories, either high, moderate, or low. Overall, coming in as a high leader index means that many of the leaders have strong relationships with their direct reports. Of course, strong relationships between the leader and their direct reports provides a great foundation for leading action planning efforts with their teams. Now, as far as moving forward, some next steps. Like I said, I had the opportunity to connect with a lot of the frontline leadership here over the past couple days, showed them the tools that they have access to with the survey results, and the tools within those survey results then provide specific actions that they can implement as a leader with their team. To summarize some of the things that we see here, the latest engagement survey shows that the workforce is deeply connected to the work that they do and motivated to make a difference. We saw that in the specific scores for the questions as well as the open-ended comments. Employees clearly see the value and impact of their roles, which provide a strong foundation for continued growth. What's working well? Purpose-driven culture. Employees report high levels of meaning and impact in their work. Strong leadership. Favorable feedback on leadership suggests our managers are well positioned to drive positive change. And resilience improvement. Gains in emotional well-being and recovery show encouraging momentum. There's opportunities, of course, to improve. Collaboration and communication, we've talked about that between department communication is front of mind with the staff in an area that we want to continue to improve. Ensuring that everyone understands how their work connects to the broader goals will help unify efforts. And engaging that neutral. We talked early on about the percent of neutral folks to that engagement index. That presents an opportunity to connect with them, and it represents a group that has the ability to boost overall engagement scores if we can move them to that more favorable category. Targeted focus areas, support for struggling teams. Leaders are able to identify specific departments that are reporting lower than average engagement scores and connect and have targeted conversations with those groups. And also learning from high performers. We have a lot of high performers within Nashville General, both at the department level and at the leadership level based off of that leader index module. Teams with strong engagement can serve as models for success across the organization. The next slide here is just an example of some recommendations that we provide at Press Ganey in regards to best practices or actions that can be done at the leadership level to drive improvement. What we did is we looked at those top 3 items of key drivers of engagement, the items that matter most to the workforce here at Nashville General, and then provide some recommended actions there to the right. Leaders will have the ability to see this within our platform, so they have that targeted approach to improvement planning, and we support them with those recommended actions and solution starters that they can apply with their team. The next few slides here, we're going to take a look at our physician engagement survey. We do conduct this in 2 different ways, simply because it's a different audience. Yes, sir.
And before you go to that, over what months were these data collected?
Mid-July to first week in August. I
Okay.
can't recall the exact dates, but it was around there, so kind of towards late summer, which is typically when we do it each year, around that same time frame.
Thank you. And back on page 10, focusing key drivers,
Yes.
we under the AHA rank, we have some first percentile.
First percentile rankings.
Okay. Does that mean what I think it means? Is it?
Yeah.
Yeah.
Yeah, we're on the same page there. Yep. So I will say this, when it comes to locations, and we track engagement across the country, this region has the highest performance in engagement. So when we look at Nashville General compared to other hospitals in this region, it's a high bar. And you'll see that as you look at the percentile rankings for that AHA4 benchmark. Nationally, it shows obviously a much stronger performance because we're looking at a much bigger picture of organizations across the country. But here in this region, scores are high in engagement across the board. So you're facing and paired with a tough competition, if you would, in regards to engagement specific to this area.
And since we're comparing all healthcare, not just hospitals.
Correct.
What percentage of the respondents in these, like the regional AHA, would be hospital employees versus something else? I mean, we're talking about 5 or 10% or 80% or?
I don't have the exact number, and I don't want to steer you wrong, so I'd have to look into that and follow up at a later date with that. But that is a good question. I'll follow up.
Thank you.
Thank you.
Can I make one statement for the board? When you look at our employee engagement survey, which, as he alluded, was conducted around July and August. So I think when I look at that, NGH conducts business in an ethical manner. Some of that is a residual of the things that we had kind of went through in regards to March. This was conducted in July, which was just a couple of months later. He's getting ready to present our provider engagement survey, which I will say was conducted in April. So I just want to share that for context. Thank you.
Thank you. All right. On to the provider survey. Again, we do ask a different series of questions for the providers just because as an audience, much different in structure and reporting relationships versus the employees. These are a few of those comments that we got back from the providers. So whether if we targeted the employee group or the provider group, the comments are still the same. They still line up with our mission here at Nashville General. I'll read through a couple of these. I'm delighted and grateful to work here. Proud of the progress I have no doubt we will continue to make in improving health here at Nashville. It's been great working in Nashville General Hospital. Serving the underserved has always been my goal. We physicians get well respected here and have a strong family-like atmosphere when working with hospital staff and ancillary services. So some great feedback to capture when the participants had the opportunity just to provide a free response on how they're feeling about working at Nashville General. Key takeaways from the provider survey: engagement. Team members are feeling more connected and energized in their work, showing real momentum. One of the key metrics that we measure on physician surveys that we don't on employee surveys is alignment, because physicians, of course, typically have that direct path to senior leadership. So we measure their feeling of alignment. And leadership is becoming more responsive, helping build trust and stronger team relationships. Mission-driven work. Providers feel proud of the work and are aligned with the hospital's mission to serve the community. And some paths to continued improvement. Improving how leadership shares and listens is a powerful opportunity to strengthen team connection and clarity. We'll dive into those survey results on the next slide here. This highlights our engagement score. You can see it's very similar to what we saw in that employee survey when we look at it from that 5-point scale module. One thing I do want to highlight beneath both the engagement score to the left, and then we're looking at the alignment score to the right. If you look just beneath each of those, you'll see the comparison data we have to the previous survey. Major increases versus a previous provider survey. A statistically significant increase in engagement overall, a variance of a positive 0.34 versus a previous survey, and on alignment tells us the same story, a statistically significant increase in the overall alignment score of 0.25 compared to the previous survey. The next slide here.
Can I ask a question
Yes.
about that, just to understand the data a little better? So there's a statistically significant increase from 3 years ago on our alignment, and yet we are in the second percentile versus national physician alignment rankings. So help me square that data. We've had this. Does that mean that in the last 3 years that has increased significantly, so that in order to get above a 2% second percentile, we need to do even better than statistically significant? I mean, help me understand that.
Yeah, that's a great question. So while we saw some positive trends in regards to the previous survey, obviously still shows clear signs of opportunities to continue to improve. The 50th percentile in alignment, it's not as big of a jump. You're looking at about a score of 3.79 or so. So to get to the 50th percentile. So I know that would be a great goal to increase by another, let's say 0.50 on the next survey, but making momentum in those percentile rankings really just requires a 1/10 of a point change. So if we can just continue with that momentum, we will see some big increases there in that percentile ranking.
Okay.
Thank you for the question. These are the key drivers specific to the physician group. Again, we kind of refer to this as that cheat sheet of what matters most to my team. All these questions that we ask them, what really matters most to them, where I as a leader can focus my attention and efforts here. You'll see our performance on these items, a few of those showing some big improvements versus 2024. So again, to the question that we just had, while these are opportunities to continue to improve and they matter most to our people, we're showing that we are improving these versus previous surveys. We just need to continue that momentum as we move forward. Looking at the highest ranked items from the provider group, we can see here my work is meaningful, similar to the employee survey. So ultimately, across the board, whether you're an employee of Nashville General or a provider that's working here, you're finding meaning in the work that you do. Also, our resilience metrics tie into some of these highest ranked items. The ability to disconnect from work, free their mind from it when they're not here. Huge thing in healthcare, obviously, that's an obstacle that a lot of folks face, especially providers, being able to step away from work. And we're seeing some positive gains here specific to that ability. Moving forward, next step, just kind of summarizing specifically on the provider group here. The 2025 survey results reflect a team grounded in purpose and resilience with high scores in meaningful work, authenticity, and equitable care. Providers feel connected to the hospital's mission and report strong personal fulfillment in their roles. Resilience scores are also notably high, indicating that staff are managing stress effectively despite ongoing challenges. While both the engagement and alignment scores remain below the national benchmarks, they have shown meaningful improvement compared to 2022. This upward trend suggests that recent efforts to enhance the provider experience are beginning to take hold. However, concerns remain around responsiveness, communication, and safety culture. So those are key focus areas as we continue to improve that experience for our providers. To continue this positive momentum, the organization, our recommendation is to focus on those key drivers, such as building a climate of trust, reinforcing ethical practices, and ensuring that leadership consistently treats providers with respect. Strengthening these areas will be essential to deepening the engagement, improving alignment, and sustaining a culture of collaboration and care. I would also like to say I come here each year after the survey. This year, the vibe's a bit different. I can see the energy with the managers I've had the opportunity to connect with over the past couple days and the employees. So while we still have room to improve as we compare ourselves to national standards, the year-over-year improvement is worth celebrating and talking about, and I can see it with the folks that I'm interacting with here when I talk about their results for their specific departments. Thank you.
Do you have data on providers of the hospital, individual physicians?
Individual physicians?
Yes.
No. So we won't break it down to a specific provider. So we try to maintain confidentiality within the group. We have reporting thresholds before we can
I
publish
understand that you
results.
wouldn't maybe present it in this forum, but that does not exist.
Down to the specific provider level?
Right.
No. We're not able to capture feedback from one respondent. We have a reporting threshold in place of 4 responses. So if we drill down to a specific specialty or department, we need at least 4 responses to calculate the feedback and present that feedback.
Is that common in a system not to have that?
Standard. Yep, standard. Because we want these surveys, we want them to be confidential. We want folks to feel comfortable in providing their feedback. So it is standard that we maintain that reporting threshold, regardless if it's an employee survey or a physician survey. Great question.
Curious, back on the highest ranked items, the last one on the list, I'm able to free my mind from work when I'm away from it. What goes into that? How is that? Can you just expand on that a little bit?
Kind of the sentiment or the intent of that question?
Yeah.
Yeah, I think it's just resiliency, decompression, being able to step away from work. I'm able to free my mind from work when I'm away from work. So when they're not here, they're able to disconnect a bit, have some peace and some mental health.
But that's a very individual issue that I wouldn't put at the doorstep of, say, our CEO.
To be able to manage an action plan on it. That's a great point to bring up. And there are things that can be done. So even specific questions like this, where it's more individually based, we do provide some solution starters, best practices that other clients have proven success with driving with their team. If it's related to decompression, it is a personal issue. Are you able to decompress? Some can do it better than others. But from an organizational standpoint, I believe it can be supported to where they help them decompress, whether that's ensuring that they're not contacting them after working hours when they're away from the hospital, respecting their time off and valuing that time off, and also providing insights to resources that may be available, such as, mental health resources that may be available, EAP programs that may be available. So just reinforcing that is one way the organization can help with it. Great question. Thank you.
I had a quick question. I believe the 2022 results in terms of response rate for physicians was significantly lower, like half, wasn't it? It was a drastically low number of people that responded to that survey.
41% responded to this year's survey.
Yeah.
That is well above our national average. Yeah. I do not recall 2022 response rate, to be honest with you.
Yeah, it was in the 20s, I'm pretty sure. So I think we've doubled the amount of people who have responded to this survey. I can't remember who I got it from. But anyways, I actually read it. So I personally feel like after reading every survey that I could get my hands on, I'm really proud of the results. I know that it may not seem as if when you look at a percentile rating, but in terms of the turnaround in a very short period of time that's happened. And more importantly, I'm really excited to see in a year from now what these results look like, because I think that we're already seeing statistically significant changes. But I think with more response, then you're going to see those numbers continue to improve. So I just want to applaud you guys as an executive leadership team for doing this, being on top of it, and making sure that we receive this information, which is also something that we were not receiving in the past. We did not know what was going on in this hospital with regard to employee and physician feedback. And I think this is the most important feedback that we can get, and then we have our leapfrog with regard to patients. So I appreciate your time and diligence.
Thank you.
Any further comments, questions? Thank you so much, sir. All right, our next item up is committee report out schedule. You should have this in your packets. It will give you a sense of month over month, the committees that will be meeting. Janet will be coordinating all of the committees and the meetings and the schedules. Each chairperson will work with Janet to make sure that these meetings go off in these months. We set them up appropriately based on the schedule. And then obviously the committee members will receive, work with the chair and then also Janet to make sure that these meetings go off and we make sure that we have a quorum and then also a report back out the next month if you're the chair of that committee. So Janet, anything to add to this? Okay, I appreciate, we are really putting a lot on Janet to, as you can see, we've gone from one finance committee meeting to all these committees. So one, I wanted to personally thank you for the time and commitment you're putting into this to get all this. Yeah, go ahead, just give her an applause. Organizing, feeding us, putting all the notes together and the meeting minutes. So I know that's a lot. Secondly, to all of you, as I stated before, who are, this is, one, a commitment to join this board because we're not at home watching Netflix right now. But the most important thing is that each one of you are committing to all this. And you're committing to doing the work that it takes to even be able to sit at this table. So I appreciate that. I know it's an ask. I know it's a lift. Many of you have volunteered and raised your hand. So I really appreciate that increased level of engagement. And then I guess the last piece I wanted to piggyback off is really about supporting the hospital and more importantly, the employees. So you receive various invites from Janet in an email that says, hey, would you respond yes, no, or tentative to these different events? I know Kathy has coordinated with Janet and has sent out some reminders, and they talk about this obviously in some of the closing comments. But, I would ask you to make a point to respond. One of the things that is important, I feel like, and I think we all do, we talk about supporting our employees, we talk about being at these events. We have a couple people sitting around the table that are almost at every event. We need to share the love. And I think that some of us can't be at all the events. So I think that it would be very helpful in planning to make sure that you are RSVPing to Janet. And then if we don't have at least one board member at an event, we'd ask that, we kind of take turns and round robin who can go. So again, we don't expect everybody to be at every employee event. We know that that's not possible, but we talk about this. So let's put it in action. Let's RSVP to Janet when she sends you an email in a timely fashion, and then let's show up. So I appreciate that. Moving on, quality. Felicia and Chrissy Lewis.
Good evening, everyone. I'm going to provide an update from July through August, just keeping in mind that the details are in your board meeting packet. So I'm basically going to cover our top 3 wins as an organization and then our top 3 opportunities and what we are doing about them. So our top 3 wins are, number 1, barcode medication administration. In your packet, it might be listed as BCMA adherence. We have exceeded the 95% goal for 5 consecutive months now. As you remember, we were really struggling with this back earlier in the year, so it's nice to see that we've gone 5 months, and in August we were at 98%. For our severe sepsis bundle adherence, we have exceeded the 58% national benchmark goal for 2 consecutive months now. And we were at our highest in July at 70.6%. So really excited to see a lot of our efforts internally moving the needle there. And then for healthcare associated infections, we have now gone 4 months without an HAI event. And specifically, we've gone well over a year now without a central line associated bloodstream infection, a catheter associated urinary tract infection, MRSA bacteremia, or a surgical site infection related to a colo, hysterectomy, or a C-section case. So great outcomes there as well. I also wanted to share that just last week, Nashville General Hospital was recognized at the Tennessee Hospital Association annual meeting, among other facilities, but we're proud of ourselves. Last year, we were recognized with the THA Zero Harm Awards in the following categories. We went an entire year without a catheter-associated urinary tract event, and that was across the entire organization. We went the entire year without a Clostridium difficile infection. That was across the entire organization. And then both our adult ICU unit and our med-surg unit went the entire year without a central line associated bloodstream infection event. Many organizations cannot say this. So I say this proudly that even considering our challenges that we have at times, that we've been able to maintain a high level of patient care in these areas. So kudos to us. Now on to our top 3 opportunities with our action plans. We have unfortunately continued to see a decrease in our hand hygiene adherence rate. And this is whether or not our staff are cleaning their hands before going into a room and after coming out of the room. And just last month, we hit a low of 87%, which was very concerning. We are actively working with all of our leadership teams to continue to coach in the moment. We consistently remind people who do hand hygiene observations that if you see someone not doing hand hygiene, remind them. Don't lose that opportunity to coach and remind the individual to do hand hygiene, but also to remind them why. We're also working with our partnership with Meharry, with our residents, and we're talking about this with them as well and bringing it to the forefront with their education and training too. Also, we are moving forward as an organization with implementing multidisciplinary peer review for our medical staff. This has been presented to and approved by the Medical Staff Bylaws Committee. It's undergoing legal review now, but we hope by the end of the year will be approved by the Met staff. So we're excited to see that getting implemented. And then for hospital-wide education on the consent process for our forensic, which are our inmate patients that are in the organization. This is an action plan that came out of a recent survey, but we were at least excited to identify that there were some gaps and misunderstandings around that consent process, where we have since done hospital-wide education. And when I say education, this all happened within a week, 7 days across the whole organization. It probably was shorter than that, but we're going to give us credit for 7 days. We are now working on distributing an expanded set of training slides for our frontline care team members with case studies so they can see various examples and scenarios around the care of our forensic patients and how to handle consent. We're completing chart audits to validate that the advanced care plans for our forensic patients are making it to their record so that we can understand ahead of time their care wishes. And working with our IT and registration teams to get these documents scanned into the medical record immediately so all partners in the care of that patient are aware. And then also we're going to be working with Dr. Elders and Christy Lewis and partnering with TDOC and Centurion to make sure that language in our contracts has clear delineation between the difference between pre-authorization and consent so that we understand the rules of engagement around that as well. That is all that I have. The only other thing that I wanted to report out is we did have a general report out over our our engagement survey results. Next reporting period, I will go over our culture of safety survey results. The speaker did allude to some of the opportunities we have there. One of the things in meeting with him earlier today that I was most proud of is to see that our scores did go up in the staff feeling that they were empowered to report. And with this, we're able to be a lot more aware of opportunities before they become bigger events so that we can work on reducing the likelihood of any patient harm. And it's showing in our outcomes that I reported. Any questions?
Remind me, how is the hand washing data collected if it's not direct observation?
It's direct observation. We have, all of our leaders, directors and above, have units that are assigned to them, and they have a minimum number of observations they have to do in specific units every month. And we take that data and drill it down to the healthcare type level so that we can see if it's, say, an issue with students or nursing physicians, and try to target our education towards those various groups. But that's how we collect it currently. We did look at the possibility of electronic technology at one time, but really with Wi-Fi needs and things of that nature, it really wasn't a good investment for us to look into. Any other questions? All right, thank you so much.
All right, thank you very much for the quality report. At this time, if there are no further questions for Felicia, I'd accept a motion to approve the quality report. Is there a second? Any further discussion? All in favor? Aye. All right, motion passes. Next up is the medical staff bylaws. Dr. Bullock.
Good afternoon. I will be giving the medical staff bylaws update report. We did have our annual medical staff dinner meeting last night, which is where we would have normally approved these. I think the last meeting we had just received the edits back from the attorney, and we do have quite a few things that we do need to modify. The biggest piece of this is we are taking a lot of the language out and putting it in appendices, which is a lot easier to modify if we need to do so going forward. So we have a pretty stringent timeline. We're still meeting weekly. Just most recently had a meeting on Monday. Our goal at this point is to have those to MEC for approval by October 16th and then voting by the med staff for the week of the 17th. And hopefully those will be able to get to our November Hospital Authority Board meeting. So we do have a plan. We are still moving along with no real bumps in the road. We just want to make sure that it's going to be sufficient and something that's easy to follow and appropriate for our medical staff. Any questions?
How long have we been working on this?
I've been working on it since I came back into the role in April.
I believe we've been working on this for several years. Mm-hmm. We applaud you for getting this done. And having the relationship with the physicians to be able to have good conversation and work together so well. So thank you for doing that.
Thank you. Any additional questions? Okay, thank you.
Next is the September credentials report. Dr. Miller.
It's a long list. We have Paul Michael, CSFA in the Department of Surgery, Alicia Jefferson, Department of Surgery, Benjamin Denner, Urology, Ethan Kellum, Department of Surgery, Pooja Karnata, Podiatry, Andrew Pierre, Podiatry, Mark Williams, otolaryngology, Patrick Souris, anesthesiology, John Siebert, otolaryngology, Michael Stannick, radiology, and then Joyce Barber, oral and maxillofacial surgery, and then we have and a new one, Sally Chinratanalab, rheumatology, Susan Krupp, renewed for rheumatology, and Byron Morgan, anesthesiology.
Thank you very much. Just a quick question. Are you seeing an increase in the amount of new appointments and renewals?
I mean,
Do you see a trend?
It seems like that the number of appointments are much higher. I mean, the number of urologists that we are seeing, number of otolaryngology that we're seeing. So I mean, it seems like that we have much better coverage than we've had before.
Buzz?
Well,
Just pointing out that all but one of these are reappointments.
This time, but I'm wondering about a trend. I was just curious as to if you that are obviously clinical practitioners, are y'all seeing trends here that we're increasing the number of people that we're credentialing? I was just curious as to if that seems to be the
I
case.
mean, I'll have to defer to hospital leadership on that.
Yeah.
I think the amount of people that we're credentialing is really remaining the same. What you will see is on some of the services where there's a lot of PRN coverage. So like in the ED, anesthesia, you'll see a lot of people coming on as we just keep the boards full. Other than that, we've had some people roll off. We are bringing on some more people. Meharry has hired a few more people recently. So overall, you may see a trend up, but there are quite a few reappointments as well, and we just kind of keep those rotating and running regularly as well.
Thank you very much. Do I have a motion to approve the medical staff reports? Is there a second? Any further discussion? All in favor? Aye, motion passes. Committee report, CEO Performance and Search Committee, Mr. Escoval.
I'll take any title you give me. Doctor is not deserved, but the CEO committee has met since our last meeting. We are, as a committee, somewhat in a period of waiting for the selection of the search firm that is going to work with us to conduct the CEO search. But we are trying as a committee to make progress in the meantime. So Derek Smith came and spoke to us about concerns that the committee had raised about, not concerns, questions about the Open Meetings Act, because when we get to the point of interviewing and talking to finalists for the position of CEO, whenever two board members or more are gathered together to deliberate something, the Tennessee legislature has decided that that needs to be conducted in an open meeting, and we will do that. But there are strategies to how to conduct a hiring search of this type, consistent with the requirements of the Open Meetings Act. So we had some discussion about that and are planning for it. In the meantime, the evaluation committee is steadily doing its work. I can't report publicly details of that evaluation process, but it is moving along quickly now. And I would hope, I don't know the exact timeline. It really depends on, some things that are beyond our control and working with Metro Procurement and their schedule. But I would hope that, we're nearing the point where we will be making final consideration of engaging or recommending a search firm to the committee, on the evaluation committee, and recommending a search firm that would then come to this board to approve that contract. And at that point, we will be ready to work with that firm and begin formally our CEO search. So I appreciate your patience in this process. The public procurement is a methodical process that goes slower than I think anybody would want it to go, but it is an important process and a good process, and we're in the middle of that.
Any estimate on when we will be able to approve a search firm? Do you think it will be the next meeting, 2 meetings?
I think a realistic goal would be 2 meetings from now. Because I think the committee has got meetings on the calendar every other week, but we could call an interim meeting. As soon as the procurement process is done and that award is made for the recommendation to go to the committee and ultimately the board, that's why I think the November meeting is the most likely meeting for us to do that. So I think a realistic and goal, and appreciate you're asking that question because we should set some timelines internally. We could start the search process with the firm in December, I think is a realistic goal.
Great, thank you. Next, Finance Committee reports, Dr. Enzare and Dr. Blackledge.
Invite Dr. Blackledge's team to do the reports and I'll do the contracts.
Thank you. Hello, everyone. Just going to talk about the August financials. Going to hit a few highlights and then kind of give another update about the financials in general, and then I'll be glad to take some questions. We're going to start with the income statement. For the month of August, we were $871,000 less than budget. And when you break that out by outpatient and inpatient, outpatient revenue was above budget by $629,000. And that is offset by inpatient revenue below budget by $1.5 million. A couple of indicators around the inpatient shortfall from the budget. Patient days were 359 less than July and 290 less than the budget. Emergency room admits were 35 less than July prior month and 63 less than budget. Expenses overall were $1.2 million less than budget, and that's primarily due to a $2.4 million end of fiscal year accrual that related to expenses that were expensed and paid in July and August that related to the prior year. So through discussions with the auditors, we booked an entry there so that we don't take that hit in this fiscal year. So those reversed in August. And then on the balance sheet, one major item of note, we had a decrease in accounts payable from $16.5 million in July to $8.6 million in August due to our continued efforts to reduce our outstanding payables. Focusing mostly on our over 90 days and of course current payables as well. So we're chipping away at that and getting closer to getting current with all our vendors. And then just a note, and then I'll take any questions. The formatting we've noticed, couple things have been brought to our attention about our financials in terms of some calculations these are system generated financials, but we did not pick up on some variances that were done opposite than what they should be. And then we have a question about our statement of cash flow, some of the calculations there, and we're going to be looking into that. We have a ticket outstanding with our accounting system vendor, and we're going to follow up on that for the next board meeting. So I'll take any questions if you have any.
All right, thank you very much, appreciate it.
Yeah, thank you.
Next up is contracts.
Thank you, Madam Chairman. So we have quite a few contracts, but I'll try to group them together for the ones based on their department. So the first one is the Car Stores lease agreement presented by Perioperative Services. 3-year term, 2023 to 2026. $6,638 included in this year's budget. No RFP process. Second one, also from Perioperative, is the Horologic, and this is the one that covers the women's health services. Women's health. So it's for, the cost is $3,250. It's not included in this year's budget.
I move approval of the 2 contracts.
Is there a second?
Second.
Any further discussion? All in favor? Aye, so that'll approve both the Carl Storage lease agreement as well as a Hologic's Care Fluent Pro.
Okay. And then the next one has to do with the inpatient pharmacy. This is the contract for 240B to help with all the regulatory issues with managing and trying to find ways for the pharmacy to save money. And the rules with 240B are very tight, so they monitor this almost on a daily basis. And this consultant provides oversight and guidance to continue to find savings for the hospital through the 240B and also help maintain the regulatory compliance that must be had to continue to maintain it. So the cost is $134,250. It's included in this year's budget.
Do I hear a motion to approve? Is there a second? Any further discussion? Who said second? Okay. All in favor? Aye. Motion passes.
And then the next one is green security contract. There's really no cost to the organization, but this contract controls vendor access. Vendors have to sign in. There's no cost involved with this contract, but it has to be renewed. It's a 3-year term from 2025 through 2028.
Okay.
Move approval.
Is there a second? Second. Any further discussion? If not, all in favor?
Aye.
Aye. Motion passes.
Then we have Archer facilities contract. This has to do with cooling of the system. Several parts of the hospital require servicing of the heating, maintaining air purification. The cost for this part is $177,795 per year. No, the first year is $199,746. Year 2 is $177,795, and the last year is $182,648. It's included in this year's budget. I would like to also. The second one is the same, is to clean the ducts within the air conditioning and heating systems. And this is a major need. It turns out, this has not been done for a good while, but I think it's something that's needed in a hospital to make sure the air is pure and maintained, and then also affects the heating and cooling system. So this one is $190,500. It's not included in this year's budget, but it's in the capital budget. So I present both of them together since they deal with the systems for heating and cooling and air purification within the hospital.
So I'll take that as a motion. Do I hear a second?
Second.
Any further discussion? Any opposed? If not, all in favor? Aye. Motion passes for both Archer and the duct detectives.
And then the EMFRA CER contract also still with facilities. This has to do with the fan coils within the HVAC systems. There are about 357 of them. The cost is $72,587. It's not included in this year's budget. Present that for your approval as well.
I'll take that as a motion. Is there a second?
Second.
Any further discussion? Any opposed? All in favor?
Aye.
Aye. Motion passes.
And the last two, Southwest Communications, basically this has to do with the security and keypads within the hospital system. The cost is $50,102. It's not included in this year's budget. And the second one also has to do with security, but has to do with getting the key systems around all the rooms in the hospital such that there will be complete inventory of all the keys and accountability for who has the keys, and if an employee leaves, they have to turn in the keys. And the cost is $125,472. So present both, since they have to do with the security and the key system in the hospital.
All right, I'll take that as a motion. Is there a second?
Second.
Any further discussion? All in favor? Aye. Any opposed? Motion passes. All right.
Madam Chair,
Yes, sir.
I'm curious about an item that was removed from the agenda about radiology, which caught my attention because it was a very significant increase from the previous year. Is that being renegotiated? Will we see that next month?
I'll let Dr. Elders answer that.
I'm going to call Dr. Brown to address that, but we did look at that and saw some opportunities, and so it was not ready to bring to the board. Dr. Brown?
Thank you, Dr. Elders. Thank you, Board. Yes, Dr. Martin, that is being renegotiated because we did have several amendments to that contract. And what I noticed was that if I'm in the base contract, then the things that were attached, those amendments that were attached, would also be a rider to that contract, which is not what we want to do. And so I had asked Dr. Elders if I could pull that contract back to come back before the board with a lot more detailed information as to how we got where we're at and then what the real costs are that are involved in that.
Thank you.
Yeah, so Mr. Farmer and I have done a deep dive. We've done some prelim work this week, and it's up on my board, and then we're going to actually provide a lot more detail to the board as to what the real costs are for those services next board meeting.
Thank you very much. Next up is Dr. Elders.
Thank you, Madam Chair and Board. And so first, I just want to congratulate the leadership team here. We're going on about 6 months, and if you can hear the celebrations in the Press Ganey scores, I think we are, too, very proud that during this tumultuous time that we did have some positive results. Still opportunities for improvement, but we're really working hard and on a journey of excellence. September 19th, we had the graduation for our School of Health Sciences. With some of you know, we have a hospital-based program that educates radiologic technologists, and we appreciate Counselor Esquivel and Dr. Enzare for celebrating with us. As mentioned in the quality report, we were awarded the THA Zero Harm Award. And then also, I didn't put it in here, but the emergency department was awarded the Medtronic Sustainability Belt Award for leadership in environmental stewardship and sustainable healthcare practices. And that was led by Dr. Bullock, our ED director, Ashley Midkiff, and our ED nurse manager, Lisa Sampson. We achieved a 45% return rate, outperforming the 35% national average and exceeding our Nashville peers. Also, this past weekend, Meharry Medical College sponsored the African Street Festival. Dr. Enzare was a speaker there, and then some of the Nashville General Hospital team did support that event, providing healthcare screenings. Originally, if you turn to the next page, we were slated to have our compensation review study at this board meeting for September, but it has been delayed, and we will have that at the October board meeting. We will be meeting with them weekly to ensure that they are prepared and ready to report in October. Just a little update on our Crossland audit. We did have a kickoff with them on August the 29th. They started working on that audit here and was on site on Tuesdays and Thursdays. They've completed and wrapped up and gathered their on-site information, and the goal for that report is October 31st. Just an update on the city valet. Suit has been filed. Respondent date is today, 9/25, and we will provide an update at the next board meeting on where we are there. Additionally, we are partnering for a clinical research center here on campus with our Meharry Medical College partners. And then looking at the parking garage upgrades, you may have heard the news story this past couple of weeks about some graffiti that was in the garage, and our Meharry Medical College responded appropriately, and so we are working on how do we upgrade the garage for our employee safety. Just mentioning the Metro Capital Spending Plan, Facilities Finance, and our procurement department met with Metro Finance this week to review and prioritize our capital expenditure request. And so, like I mentioned earlier, I spoke with Kevin Brown, and that's kind of the first partnership of its kind in years. And so we want to celebrate that. We have renewed partnerships or ongoing partnerships with Metro Public Health Department and the Metro Office of Family Safety. We're looking at overseeing a nurse practitioner to provide services for domestic violence victims. That potential start date is January of 2026. I already mentioned the award. We mentioned provider engagement already. We have rolled out our conflict of interest disclosures. You all, as a board, have already completed yours, but our conflict of interest disclosure was provided to 125 NGH employees with a mandatory completion date. It was one of the things that the board was concerned about. That mandatory completion date is September the 29th. As I mentioned previously, when we're talking about kind of challenges, the Tennessee Department of Health has been in and out of Nashville General since August the 18th due to various complaints or reports. And so we did have 2 condition level findings, which I've shared with several of the board members. And then they did come on site on the 23rd. It's my understanding that we've completed that survey and there were no findings for that survey. And we were informed of that today. On September the 14th and 15th, we did experience 3 different floods from failed valves on toilets. And so that industrial hygiene cleanup was quoted not to exceed $94,000, and then the physical repair for those drywall areas was equivalent to about $18,000. So we're working through, what does our property insurance coverage look like? Historically, Nashville General has managed those repairs without property damage coverage, and so we are working through what that looks like in the future. And so then I also just lastly want to thank the Hospital Authority Board for their continued support. And we continue, our journey to excel. And so funding and philanthropic support is what we need to enhance our patient experience and as we continue to grow and change. And so I just thank you for your commitment, and that is the end of my report.
Thank you. And for those of you who may need the link again to be able to donate to the foundation, I'm sure Jan will be happy to send that back out to all of us to give us an opportunity to do that. There are some tax law changes for those of us geeks in the investment world and the accounting world that it actually benefits you to kind of front load those gifts this year because they're going to be looking at some changes that will require kind of a set limit, a watermark to be able to, or having to be able to lose them or roll them forward. So definitely talk to your CPAs or your investment advisors. But for those of you who might want to give more, feel free. Mr. Lesser.
And on that note regarding the foundation,
Hey.
the good news is,
Your light's not green.
my light's on.
Okay.
I can see it. And I'm colorblind, but it's green. But the good news regarding the foundation, and I appreciate Dr. Elders and our chair reminding us about contributions to the foundation for this hospital and the work we do here, is that the foundation is on a fiscal year which began July 1st, which means in order to get everybody on board, you can make your contributions now. And I would appreciate any consideration at any level, although the more the better, being as generous as you can possibly be. But remember, it helps us when we're asking foundations and others for money when they say, is your board on board? And we want to be able to say 100% on board, as it should be. Thank you, Madam Chair. And my light is...
Oh, Lordy. Tough group. Board Chair's report. There's nothing on in terms of the Board Chair's report, only just a couple things to mention with regard to the meeting schedule. So our next board meeting is October 30th at 4. We do have one scheduled in November, which is November 20th, which is a different time than we normally do our meetings, which is the last Thursday. So please make note of that. I have an auto revolver on my calendar, and I always have to push it up because that's Thanksgiving and we won't be here. So hopefully you're with your families then. So again, make sure you change that for November 20th. Also, December. I don't know about many of you, but we've had a little bit of a tradition of kind of skipping that meeting. I think the organization is well equipped to be able to bring those contracts to Dr. Enzare and his committee in November, or hold them till January. So unless I hear differently from each of you, I think I would like to skip December if that's okay with the board. Okay. All right. Feels like I'm seeing head nods. It's like being at church. I need to see you nod. I need to see everybody nod their head. Okay, great. Okay. All right. On that, last item is Nashville General Hospital has been kind enough to allow us to receive a free flu shot. We have somebody coming up here to perform those now. And hi, how are you? Thank you. So right down this hall, she will give you a shot on your way out the door if you would like. And that is it. So she'll be here from 5:30 to 6. 5:30 to 6. So roll up your arm and get to business. So I roll up your sleeve. There we go. Not your arm. That is it. All I have for today. So thank you very much. A timely meeting, getting all this stuff done in less than really an hour and a half. So I appreciate everybody's time, and thanks, Derek, as always, for your counsel through Metro. And I'll take a motion to adjourn. All right. Second.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.